Hello, my name is Dr. Umeh. Today I want to bring to you some facts, because when you understand the right things to do and do them at the right time, you can get yourself freed from these chronic joint pains. We all hear about arthritis, but do you know that arthritis is actually an umbrella name which comprises over 100 different types of diseases that affect the joint? All of them have the common symptom of causing joint pain. Okay? So you have osteoarthritis, you have rheumatoid arthritis, you have gouty arthritis, you have ankylosing spondylitis, you have enthesopathy, you have spondylosis, you have tendinopathies, you have juvenile arthritis, and many more. But the commonest of them all is the one known as osteoarthritis. In fact, if you have 10 people with arthritis, over 6 of them will be diagnosed of osteoarthritis. But today, in general terms, I want to talk to us what you need to know and what you need to do if you want to be free from the chronic joint pain known as arthritis. As I always say, knowledge is key. First of all, you need to understand what arthritis is. Arthritis is not that pain not only that pain in your knee. It is the pain affecting every joint, every movable joint, including the knee, the hip, the ankle, the shoulder, the elbow, the wrist, even the neck and your lower back. All these places are affected by arthritis. Second thing you need to know is that pain you are passing through, that pain you are having in your joint, is actually not the arthritis, but the symptom of arthritis. So that pain is not the disease. The disease is the wear and tear which is causing the pain. What do I mean by that? There is this progressive destruction of the ligaments, cartilages, and other tissues of the joint, causing wound inside the joint. That is the arthritis. In one of my last lectures, I said arthritis is like an acid. You know, when you pour an acid on something, it eats into that substance. And the more you pour the acid, the more it destroys that substance until that substance is completely destroyed. That's what arthritis does to the joint. So that progressive destruction of your joint, the ligaments and the cartilage of your joint, is actually what causes you the pain. This fact is very important for you to note. If you understand this fact, it will be easy for you to understand that everything you are doing, every medication you are taking to stop the pain is a waste of time. If you do not do anything to stop what is causing the pain, this is where people make a whole lot of mistakes. This is actually the biggest mistake people make. And that's why we'll continue to emphasize it in all our lectures. Don't waste your time trying to stop the pain, trying to take medications for the pain, or do whatever you need to do for the pain. If you are focusing on the pain, you are simply focusing on the symptom and not the disease. If you want to treat arthritis, the most important thing you need to do is to treat that destruction, that degeneration, as we call it. If you can stop that wound or heal that wound or destruction, also known as degeneration in your ligaments and cartilages, when you heal it, the pain will go. As I said, arthritis is like a wound. So if you have wound and you don't heal your wound, the pain the wound will be causing will always be there, no matter how much painkiller you take. That is a very important fact to note. Another thing to know is there anything or any treatment that can heal those degeneration? Unfortunately, many people do not know that at this time and age, science and medicine has evolved to the point where it has discovered that there is now a treatment that can heal those degeneration in your ligaments, cartilages, and tissues of the joint. And that treatment is not medicine, is not drug, is not anything you rub. That treatment is actually done using your own, the patient's own blood platelet cells. So where this treatment is done, what the doctor does is to collect your own blood, because inside your blood there is a cell that is known as platelet cell. So that platelet cell is harvested, and when it is injected into that joint, it releases its content known as growth factors, and those growth factors, as their name goes, they grow back all those damaged tissues of your joint. That is another important thing to know. But does it mean that it is every category of degeneration that it can heal? The answer is no. As I always say, chronic diseases like arthritis is more rewarding to treat when you catch them early enough. What this implies is that arthritis gets worse from stage 0 to stage 1, stage 2, stage 3, stage 4. The possibility of achieving 100% cure is higher at the early stages of the arthritis. So these are the important messages I came with today, so that at least you know what your problem is and know the treatment to use. If you do not understand what the problem is and you are taking treatment, you are most likely treating the wrong thing, which is what many people are doing. Buying medications, treating pain, which is actually not the problem. The problem is what is causing the pain. If your doctor does not talk about regenerative therapy, and the typical examples we have in this part of the world is platelet-rich plasma, also known as PRP, prednisone, or cold laser. If he does not mention any of these three and still prescribes medications for you, look for where you can do regenerative therapy. The doctor does not have any solution for your pain. Thank you very much for your time.